XII 12 News. This is special coverage of the coronavirus impact.
A triad disease expert shares his cautious optimism in the battle against COVID-19.
And the coronavirus has pushed the 2020 Olympics back a year to 2021. I talked to a local Olympic athlete about what this means for her and her training coming up.
And one of the state's top lawmakers shares his plan to reopen restaurants in North Carolina. First at 10, breaking news. Sheetz is confirming that a worker at its location in Trinity has tested positive for COVID-19. The store is on Finch Farm Road. A spokesperson for the gas station and convenience store says this employee was last in on March 19th. Officials are working to figure out who may have had close contact with this worker. Right now, the store is closed so it can be deep cleaned and disinfected. We're told gas pumps will also be cleaned and sanitized. New tonight, 2 more state prisoners have tested positive for COVID-19. They're in the minimum custody unit at Noose Correctional Institution in Goldsboro. They're both men in their 40s. They're in isolation right now and their entire unit's in quarantine. State prison officials say there are a total of 7 cases within the state prison system, including 3 inmates and 4 employees at 6 locations. The number of people testing positive for COVID-19 in North Carolina is over 1,800 now. That number isn't expected to peak for still a couple more weeks. Today we learned that 2 more people died in Guilford County. 8 people in our viewing area have died so far this week. And tonight, a grim milestone. The number of confirmed coronavirus cases worldwide topped 1 million. The U.S. has the most cases in the world with almost 250,000. Italy has the highest death toll with about 14,000. As the triad continues to follow the state's stay-at-home guidelines, a doctor says he is cautiously optimistic with the work already being done. Today, Wake Forest Baptist Health infectious disease specialist Dr. Christopher Ohl gave an update on the disease. Our Meredith Stutz reports on his outlook on testing, supplies, and people who aren't showing any symptoms.
When comparing the COVID curve here in the triad, Dr. Ohl says ours looks more like a foothill compared to a small mountain in the Charlotte area, but says we still have a few weeks before we reach the top of the hill. Dr. Ohl says he believes the triad is seeing fewer cases due to a smaller and more spread out population. He believes social distancing is working, but says we're nowhere near being able to loosen up. Dr. Ohl says Wake Forest Baptist facilities are not giving a COVID-19 test to anyone who wants one. He admits this can explain in part for why case numbers may be off the actual COVID count. Priority for testing is given to healthcare workers, those hospitalized, the elderly, and those with underlying health conditions, the most at-risk population. Instead, he encouraged those who are able to stick out their illness to be at home in isolation to save medical supplies and testing kits. Dr. Ohl says supplies like ventilators and PPE are tight and donations are still welcome, but Wake Forest Baptist facilities are not skimping or having to sign out masks. He also spoke on why he isn't overly worried about not testing people who have the novel coronavirus but are asymptomatic.
They may have a part in household transmission from an asymptomatic person to another. It may have a component in certain close groups of people like church groups and choirs and people who should be social distancing otherwise. But from just walking down the street, going in the grocery store, standing in the takeout line, if you're doing your 6 feet and social distancing, I don't think transmission from asymptomatic people is really an issue.
On a beautiful day like today, Dr. Ohl made it clear that we're still able to get outside and play social distancing sports like tennis. But we do need to keep that space between us. And it's those specific choices you and I both can make that can help keep our curve a foothill. Reporting in Winston-Salem, Meredith Stutz, WXII 12 News.
The 2020 Olympic Games have been rescheduled to 2021, part of an effort to prevent the spread of the coronavirus. And while athletes say they understand why the Games have been postponed, some are struggling to maintain their proper training. Our Brandon Bates caught up with triad native and Olympic medalist Kathleen Baker, and they talked about the toll this is taking on her and what she's doing to stay motivated. Brandon joining us once again tonight from his home. How's Kathleen doing?
Well, Brianna, you know this has to be hard for her, someone who loves to be in the pool. Before this all happened, before the coronavirus swept the world, she was in a pool for 4+ hours a day, and now her training has shifted from out of the pool. She's doing everything she can to keep her skills sharp. Take a look. A normal day for Kathleen Baker involves hours of swimming and extensive training.
So it takes up my whole day, all day, every day, and right now that's just not what's happening.
But now, with so many restrictions as a result of the coronavirus pandemic, her routine is far from normal.
I've just lost a little bit of a purpose.
Without access to her training facilities in San Diego, the 23-year-old Olympic medalist is finding new ways to keep her Olympic hopes alive.
I like going a lot of hikes. I've started running sprints. My boyfriend is a Marine, so he has like a nice gym in his garage that I can go like lift weights at.
Baker was in a great position heading into the 2020 Olympic Games.
I have to make sure that I'm on it next year.
And she's currently first, second, and third in the world in 3 different swimming events.
I would say that it's been devastating, but it's also made me realize that I can make myself have joys in my life outside of just competing.
Baker says she knows that we are all in this together and everyone is losing something right now.
When I think about it in like a bigger picture, it helps me a little bit more, but at the same time, it's still just really, really hard.
And while she continues to find different ways to stay in peak physical shape, she says it's fun pushing herself outside of the pool.
Really, the hiking is what's killing me. Like, hiking's hard.
And Kathleen said while she was in a great spot for the 2020 Olympics, she's hoping to use this extra time to her advantage for the time 2021 comes around. And if you've ever seen her swim, you can agree with me, she'll probably do just fine. Reporting live from my house tonight, Brandon Bates, WXII 12 News.
Good to get that update, Brandon. Thank you. Meanwhile, President Trump says the feds are working around the clock to make sure small business owners can keep their workers on payroll through this crisis. The Paycheck Protection Program begins tomorrow, allowing business owners to apply through banks. President Trump also says more N95 masks, rapid coronavirus tests, and ventilators are on the way.
We've gotten 4 million N95 respirators, 1.8 million surgical masks, 460,000 face shields, 1.4 million gloves, and 4,400 ventilators just to the city and to the state of New York.
The president also says he has tested negative for COVID-19 after taking one of the new rapid coronavirus test kits that returned results in just 14 minutes. Nearly everything in our lives has changed, including the way we walk into a store. New video we shot at the Walmart store in Lexington shows people practicing social distancing. The store has put up caution tape for people to form lines just outside the store. And you can see people appear to be standing in line far apart from each other as they wait to go inside. Well, it doesn't matter if you're 9 or 90 years old. Everyone is curious about when things are going to get back to normal. Our Kenny Beck spoke with Senator Thom Tillis today via Skype, and one of the things he asked him just happened to be the very thing he had discussed earlier today with members of that coronavirus task force. That is, when things are going to get back to normal. Listen to his answer.
I'm going to leave it up to people, experts like Dr. Fauci, who basically has said you can't answer that question until we continue to see an increasing number of people heeding the advice of social distancing and doing their part. It could be a matter of weeks, it could be a matter of months. But here's the other part. Once we reach the peak of the curve, which I believe is going to happen in the coming weeks, we cannot take our foot off the accelerator.
Well, Tillis says one of the biggest mistakes we could make would be thinking that it's over and relaxing restrictions too soon, then experiencing another wave. The number of people filing for unemployment in North Carolina continues going up. 355,000 people have filed claims since mid-March. The state's Assistant Secretary for Employment Security says that amounts to almost 1,000 claims an hour, 24 hours a day for the last 2 weeks.
We know that a lot of people have had problems accessing our system or getting through on the phones. This is not acceptable. We've taken immediate action in the face of this historic challenge. We hear your frustration, and I know the importance these benefits will have during the times of uncertainty. And we are working around the clock to be there for the North Carolinians who need our help.
Lockhart Taylor says the division is adding hundreds of people to help handle phone calls. They're also upgrading phone systems and computer servers. You can apply for unemployment by clicking the link on our website. Just go to WXI12.com and look for the Coronavirus Piedmont Triad Resources list. North Carolina's top lawmakers suggesting the possibility of opening some restaurants. Senate Leader Phil Berger says many of those businesses won't survive a lengthy shutdown caused by this pandemic. The senator told us through FaceTime today he believes there is a way this can be done. Restaurants could reopen while still utilizing social distancing measures like limiting capacities and keeping tables at least 6 feet apart.
I'm just asking that that be considered. Again, I believe we'll be in a better position to make that kind of decision or to be an advocate for doing something like that if we had better data.
Berger's plan for better data is random testing, an idea state health officials have already discounted. Lawmakers are scheduled to return to Raleigh by the end of this month.